Assalamualaikum. We are from Group 2. We'll presenting our first assignment entitled The Screening on Knowledge of Diabetic Retinopathy Among Diabetic Patients aged 40 years old and above. The topics covered include background problem, methodology, results and analysis, discussion, conclusion and references.
Background of the problems consists of definition of diabetic retinopathy, which is diabetic retinopathy is a condition that occurs in people who have diabetes as a result of damage to the blood vessels of their retina. The potency to obtain diabetic retinopathy is when people have type 1 or type 2 diabetes and have long history of uncontrolled high blood sugar levels. Diabetic retinopathy is classified into two major types, which is the first one is the non-proliferative diabetic retinopathy, NPDR, and the second one is the proliferative diabetic retinopathy, PDR. Next is the prevalence of diabetic retinopathy in Malaysia. The first one is diabetic retinopathy is reported to range from 44.1% to 48.6%. The second one is the other studies have shown that the prevalence of diabetic retinopathy is 12.3% for type 1 and 22.3% for type 2, which means people that have type 2 diabetes have more tendency to get diabetic retinopathy. The third one is the prevalence of the proliferative diabetic retinopathy reported by the diabetic eye surgery, which is 7.1%. Next is the community's knowledge screening proposal. So the aim is to provide knowledge on diabetic retinopathy as a secondary disease of diabetes among the population of diabetic patients aged 40 years old and above. So the reason for choosing this target group because people aged 40 years old and above are more likely to have a tendency to get diabetes. So we want to conduct an awareness campaign on diabetic retinopathy to this target group. This is due to a lot of diabetic patients are not aware about this eye disease. So we want to provide, spread and share knowledge about diabetic retinopathy to all the diabetic patients generally in order to minimize the incidence rate of the diabetic retinopathy.
For methodology, these studies was a type of descriptive case studies by using only one method, which is quantitative method design, where the platform that we use were the online Google platform. For the online Google platform, the screening was conducted in duration of 1 week between November 28 until December 4 among the Malaysian population. The criteria were patient diagnosed with diabetes and above the age of 40. After the approval obtained from the moderator, the questionnaire via the Google form was distributed by a group of 6 members to at least target 100 diabetes patients aged above 40 years old through the link shared on the WhatsApp, Facebook, and Instagram. The participation were no cost and self-administered. However, the phone number of a group members was available in the Google form, and the wording during the distribution for the patient to assist in filling out the questionnaire or answering any question or concern regarding this online Google platform. Other than that, the study were written using the bilingual, which is English and Malay. The diabetic retinopathy awareness questionnaire were consisted of 31 questions and 4 sections, which is the demographic, diabetes information, diabetic retinopathy, and also the last one, which is the appreciation, where all of them were written in bilingual. The first section is about the patient demographic, such as the name, age, gender, and level of the education, which is question 1 to question 11. For the second section, we're assessing the knowledge of their own diabetes, which indirectly also ask about their general health other than the diabetes, and also their lifestyle, which is the question 11 to question 17. The third section, we're assessing their knowledge or awareness on the diabetic retinopathy, which include the causes, the signs and symptoms, treatment, prevention, risk factor, and the annual eye examination, which is question 18 to question 30. The final and the fourth section is about the appreciation, where here we provide the link for help tools such as the Facebook for them to join, which is the last question. From all the 31 questions, some of them were selected questions used in the previous published Turkey study added by the researchers in Jordan University Hospital study and also the Colombo South Teaching Hospital Sri Lanka study and were used to create this questionnaire. From this descriptive case studies data analysis, a total number of 107 participants were collected from this awareness study. The data were collected from screening questionnaire via the Google form and presented as in percentage. Microsoft Excel 2019 were used to compile the data, interpret the data, and also to make the last conclusion. From the data, the association between the participant demography, knowledge of diabetes, and also the knowledge of the diabetic retinopathy can be determined.
For the results, there are three parts which consisting the demography of respondents, general health and lifestyle, and lastly the knowledge of diabetic retinopathy. A total of 107 respondents were enrolled in this screening with 41.1% have diabetes and 58.9% are the guardians of diabetic patients. 43.9% of diabetic patients were male and 56.1% were female. 38.3% of diabetic patients have school education level and 61.7% have college and university education level. The duration of diabetes among the patients that is less than 10 years, 60.7%, and more than 10 years, 39.3%. The vast majority of respondents never heard of diabetic retinopathy before this, with 49.5%, think that diabetes can make them blind, with 68.2%. The vast majority of respondents do not know the symptoms of diabetic retinopathy, with 59.8%, and do not know the risk factors of diabetic retinopathy, with 43%. The vast majority of respondents think that diabetic retinopathy can be prevented, with 72%. The vast majority of respondents do not know the effect of diabetic retinopathy, with 44.8%, and do not know the treatment options for diabetic retinopathy, with 65.4%.
Overall, the only factor of knowledge of diabetic retinopathy definition are education level, with college level is 48% and school level of education is 22%. This gives a huge range between higher education level with lower education level in terms of common knowledge of diabetic retinopathy. In the other hand, subjects with no idea about diabetic retinopathy had no link to the education level. College level and school level of education give percentage of 51 and 49% respectively. However, school level of education has higher result in had no idea of diabetic retinopathy and an idea about diabetic retinopathy of 26 subject and 9 subject respectively. Based on the data of diabetes and living area of the subject are not contributing to the knowledge of diabetic retinopathy. The data shows the smoking status and duration of diabetes of the subjects. Subjects who are smokers are higher in diabetes more than 10 years group, 26%, while 7.7% in diabetes less than 10 years group. This is due to the age of the subject. Subjects who had diabetes less than 10 years are more likely to have younger age range between 40 years old to 62 years old, while the diabetes with more than 10 years are aged between 42 years old to 80 years old. Subjects with younger age may know the potential outcome of smoking while suffer from diabetes condition.
The data shows the thought on diabetic retinopathy can cause blindness and duration of diabetes of the subjects. Subjects who thought that diabetic retinopathy can make them blind are 67.7% with diabetes less than 10 years and 69.05% with diabetes more than 10 years. This means the durations of diabetes may not play parts in the thought on diabetic retinopathy can cause blindness among subjects. There are 43 of the participants, which is 40.2% that acknowledge the symptoms of the diabetic retinopathy. The result shown in the graph is 46.97% among the total of participants that undergo college or university, and 29.27% among participants that undergo school for level of education have none of the symptoms of diabetic retinopathy. For type of diabetes, we can see that the prevalence for participants that have type 1 diabetes is higher than type 2 diabetes. Participants that have type 1 diabetes which get the disease by hereditary may gain the awareness of diabetic retinopathy by their surrounding like their parents. 48.78% of participants that exercise regularly have acknowledged the symptoms of diabetic retinopathy rather than participants that do not exercise regularly. This result shows that high level of education, type of diabetes, and participants that exercise regularly may be a factor that they are more aware of diabetic retinopathy.
From the results that have been studied, there are 43 of the participants, which is 42.2%, aware on the risk factor of diabetic retinopathy. Among them, 32 were university graduates, which found to be 47.6% from the total number of university graduate participants, while another 11 participants represent only 26.8% among the school leavers. This suggests that higher education may influence the knowledge regarding risk factor, which cause them to be more aware. Another factors that may contribute to the knowledge of risk factor is duration of the diabetic retinopathy. Among 47.6% of participants who have duration of diabetes more than 10 years was aware on the risk factor of diabetic retinopathy, while only 35.4% of participants with duration of diabetes less than 10 years aware on the risk factor. Thus, the longer duration of diabetes may cause the participant to become more alert to take care of their body well, which increase the awareness on the risk factor, while short duration of diabetes may cause they have less exposure to the diabetes complication, which is diabetic retinopathy.
Next, we move to the knowledge on the effect of diabetic retinopathy. From these participants, there are 23 people are having diabetes for less than 10 years, which refer 35% of the total participants that have diabetes with less than 10 years. Meanwhile, 22 participants are having diabetes more than 10 years, which represent 52% of the total patients with the duration more than 10 years. This data shows that the duration of the having diabetes can affect the individual's general knowledge. Other than that, 25% that aware on the effect of diabetic retinopathy also having other health problems. This number of the participants represents 45% of the total participants that have other health problems. This result show that most of the people with other health complications are more aware on the effect of diabetic retinopathy, maybe due to the frequent consultation with the general health practitioner. Next, there are 30 participants that acknowledge the effect of diabetic retinopathy is already heard about it before. This value represents 77% of the total number of participants that have heard on diabetic retinopathy. This indicates that the general knowledge that participants have can influence their acknowledgement on the effect of diabetic retinopathy. One of the factors that might influence the general knowledge is an educational level. Based on the response, there are 31 responses that have college level of education have an idea on the effect of the diabetic retinopathy. This record percentage of 47% the total participants that have college level of education. Next is the knowledge on the treatment of the diabetic retinopathy. The table shows more than a half of the total respondents, which is 35.4%, did not know about knowledge on the treatment options. If we relate with the duration of having diabetes, many of them that answer for no have diabetes less than 10 years, which is 45 respondents. For education level, both college and school have the highest respondent that answer no, which are 62.12% and 70.73% respectively. There are still few respondents that answer for yes for this knowledge. The number of respondents that answer for yes for college and school is 90 and 6 people respectively. Based on the duration of diabetes, respondents that answer yes are 40 and 11 people for less and more than 10 years respectively. Based on this table, 18 people answer for yes have already heard about diabetic retinopathy, so maybe they have basic knowledge on diabetic retinopathy. However, respondents that have not heard about the diabetic retinopathy are the highest, which is 79.25%, indicate 42 people. Respondents answer for maybe is the least, with 15 people responding to this. It does not account either they have heard or not about diabetic retinopathy.
Okay, now we move on to the discussion part. The National Health and Mobility Survey (NHMS) 2011 has shown that the prevalence of diabetes in Malaysia has increased by 31% in the space of 5 years. This increment recorded from 11.6% in 2006 to 15.2% in 2011. Our study showed that some of the participant diabetic patients claim to be familiar or aware on diabetic retinopathy, which represent 36.4%. 49.5% of the participants have never heard about diabetic retinopathy at all, while another 14% are not sure. This is worrisome, as in Malaysia it has been reported that the prevalence of diabetic retinopathy ranges from 44.1% to 48.6%.
Our screening results show that there are 39.32 participants that have been diagnosed with diabetes for more than 10 years. This amount is quite significant as the diabetic retinopathy is closely linked to the duration of the diabetes mellitus. Moreover, this can be proved by our screening, which recorded 52% of the total participants that have diabetes more than 10 years are aware on the effect of the diabetic retinopathy. According to the screening for the diabetic retinopathy report, diabetes eye disease is the commonest cause of the visual loss in adult working age in Malaysia. The prevalence of the diabetic retinopathy is closely linked to the duration of the diabetes. At diagnosis, less than 5% will have retinopathy, while after 10 years, the prevalence rises to 40 to 50%.
Okay, based on the result that we obtained, 68.2% of the participants are aware that diabetes can lead to blindness, while 4.7% thought it cannot cause blindness, and to 27.1% participants are not sure about it. According to the National Eye Survey 2014, diabetic retinopathy is the second leading cause by blindness after cataract. The prevalence of diabetic retinopathy that causes blindness is 10%, while cataract is 58%.
In our study, the participant was asked if they have any other health problem other than diabetes. The 32.3% of the participants reported that they do not have any other health problem, while the rest of the participants have other health problem. The health problem listed are hypertension, heart problem, hypercholesterolemia, kidney disease, thyroid, and gout. From the Journal of the Screening of Diabetic Retinopathy, the risk factor for the site-treated diabetic retinopathy are chronic kidney disease, cardiovascular disease, and hypercholesterolemia. So, it is quite significant for them to have an awareness on the risk factor for the diabetic retinopathy related to our result. There are 44.6% of the participants that have another heart problem are aware on the risk factor of the diabetic retinopathy, while the rest are not.
Other than that, there are also some questions asking on their lifestyle, such as smoking habit and exercise frequency. There are 85% of the participants reported not smoking, while the other 15% is a smoker. Besides, only 38.3% was found to exercise regularly, while the other 61.7% did not having a regular exercise. According to the journal entitled Screening of Diabetic Retinopathy, it states that the risk factor of diabetic retinopathy can be modified to reduce the progression of diabetic retinopathy. The modification involves the modalities of risk factor that can be included: healthy diet, regular exercise, and stop smoking behavior.
When the participants were asked if diabetic retinopathy can be prevented, only 1.9% of the participants said that it cannot be prevented, while the rest said it can be prevented. As stated in Community Eye Health Journal, there are two prevention methods that can prevent the diabetes. One of the methods is done by improving the management of the diabetes to slow down the onset and reduce the severity of the diabetic retinopathy. From our screening result, there are the range of 37.4% to 41.1% believe that high cholesterol level and high blood pressure can lead to diabetic retinopathy.
65.4% of the participants do not know the option of the treatment that is available to treat diabetic retinopathy, while 23.4% report that they know the treatment option for diabetic retinopathy, and 11.2% said that they are not really sure on the treatment. Nevertheless, there are many treatment modalities available at every stage, such as intraocular steroids and vitrectomy. But the most standard practice for treating diabetic retinopathy is laser photocoagulation. However, most of the participants are still not aware of the diabetic retinopathy, as 59.8% participants do not know the symptoms of the diabetic retinopathy, and only 40.2% and 42.1% participants know risk factors and the effects of diabetic retinopathy respectively.
Our study found that although 77.6% and 68.2% participants were aware that controlling blood sugar level can help preserve their vision and diabetes can damage their eye, only 49.5% claimed to have heard on diabetic retinopathy before this. However, 63.4% participants did the eye checkup for the past a year. Eventually, there are still participants that are not aware on the importance of ophthalmic eye screening, as 33.6% participants did not remember the last time they had their eye checkup, and the rest are not getting their eye checkup up in a year. This indicates that the need for the increasing the awareness of diabetic retinopathy among Malaysian diabetics and the significance of the annual eye examination for the patient with diabetes mellitus.
For the conclusion, based on our screening, the current knowledge on diabetic retinopathy among diabetic patients was only moderate to low. In addition, the awareness of diabetic retinopathy also low in this study. The result from the data showed that the last eye checkup of the subject is mostly more than 1 year. However, most of the subjects still have common information about diabetic retinopathy, but they are lack of information about an idea about diabetic retinopathy on subjects with low education level, such as school level of education. However, we need to take an action to increase subject education and further explanation of diabetic retinopathy are required to reduce diabetic retinopathy prevalence. Hence, the campaign or program of this condition might be effective in improving knowledge on diabetic retinopathy as a secondary disease among population of diabetic patient aged 40 years old and above. That's all from our group, the studies of diabetic retinopathy, 40 years old and above among diabetic patients. Thank you. Assalamualaikum.